Greetings and welcome to the UC San Diego AI Alumni Council webinar series. Today, we focus on student spotlights. For context, today's session is part of the Foundation series that the Council is putting on, which has 3 distinct perspectives every quarter. And this month, we close Q1 with our very first Student Spotlights session. In January, we had AI Meets Life, which is not your front page headline applications of AI, but surprising ways that AI is affecting our lives today. And last January, we featured Qualcomm and Carbon Robotics. In February, we did the ROI case studies. We had 10 case studies across a variety of industries and across a variety of functions within the organization. And today, we have our first Student Spotlight session. So we'll start with this cadence again in Q2 with, of course, fresh content, but also I'm going to reorder it because I didn't realize our students are straight smack in the middle of finals week. So the presenters today are absolute heroes. I know when I was in finals, there's nothing else I could have signed up for. Kudos to the teams that are presenting today. So next quarter, what we're going to be doing is we're going to be changing the order of this, and we'll be doing the student spotlights in May, the middle of the quarter, instead of June, the end of the quarter. And that is the cadence we'll repeat from here on out. Today, we'll start with a few updates. And then we have 3 student teams presenting their initiatives, and their projects span the use of AI in bioengineering, behavioral sciences, and healthcare. I do hope to have time for Q&A after each team, and then we'll close with what's coming up next, and we'll get started with some updates. Of course, this is a new council, so we want to hear from you. There's several ways to get involved. All the links you see here are also on this QR code, so if anybody wants to scan this now and join some of these things while we're talking, great. Join the LinkedIn group. That's where we post everything. There's a survey that lets us know what you want to see from us in terms of content. Definitely want to hear from you on what you want to hear. And then, of course, Triton Giving Day is coming up. I'm sure many of you alumni get the emails. I know I get them, and I participate. I encourage everyone to as well. We are also always wanting to get our bench of speakers deeper. So if you are interested in presenting an ROI, or in one of our where AI meets life, or if you're a student and you have a project, please contact me, or you can do a speaker submission form. And this is just a quick reminder. Here's your executive council for the AI Alumni Council. And you don't have to remember the names, faces, titles, or anything, but what you can do is when you join the LinkedIn group, all of us are managers of the group. So at any point in time, you can reach out to us through that LinkedIn group, connect with us, message us, etc. So I encourage you to contact us. We'd love to hear from you. First up, we have Tristin Esfandiari, who is tackling something every organization struggles with, but very few have been able to quantify. And that is human compatibility at work. That's a biggie. Tristin recently completed his MBA at the Rady School of Management here. And after he'd earned his BA in international business, both degrees from UC San Diego. As founder and CTO of Mauralink, can't wait to hear from you, Tristin. Tristin's leading the technical development behind this new AI-driven platform that translates decades of behavioral science into a measurable compatibility signal. This has implications across hiring, team formation, leadership decisions, areas where intuition has historically dominated over data. I think what's particularly compelling here is the engineering challenge that's presented. How do you take this rigorous, complex science and behavioral data and make it feel seamless and usable in a real-world workflow? So today, Tristin will walk us through how they're building that bridge between behavioral insights and practical application. And Tristin, we're excited to have you, and I will turn it over to you.
Awesome. Thank you so much for having me. I really appreciate it. So today, the talk is going to be a little bit different. Instead of pitching my company and telling you what exactly we do, I want to tell you the story of how I am building this company by myself as a CTO and how I've been using AI on a daily basis. we all know how AI, the different flavors of artificial intelligence, you have generative, agentic, multimodal, and machine learning. And I have really captured a way to use agentic throughout my daily workflow. And for some context, I have used Claude almost every day for the past 2 years. And with before the last 6 months, I had to start a conversation every single time with a new thread. I started from zero, having to spend the first 30 minutes of my day re-explaining the project, what we're building, what we've decided from last week, and what some of the psychological or industrial organizational psychologists gave us about like legal liability. And I've had to reestablish that context every single time. And AI was supposed to help me build this company faster. And luckily, I've managed to build something incredibly unique. And over the last 4 months, we've built 600,000 lines of code. We have 2 paid pilots. There's 2 founders, myself and our CEO, with 0 engineering hires. At my previous company, Uniwires, I had 15. And it took us 2 years to build a product. But today, with the technology that Claude has enabled us with, this entire technology, the stack that we've built, this product that is currently working in an enterprise company, is built entirely with artificial intelligence through a unique workflow. So the bottleneck isn't the model's intelligence, it's context engineering. As we all know about prompt engineering, where you have to spend so much time trying to get the perfect prompt, we've moved to a new stage where it's about context engineering, where you load the model with specific context maps, different tools. You enable it with dynamic memory over long term and comprehensive instructions and skills. And you load that and you manage that into a context window. And from that, you can build something beautiful. This is a really great quote from Andrej Karpathy, who's the OpenAI co-founder and really was the genius behind the novel architecture of generative pre-training transformers. Context engineering is the art of providing all the context for the task to be plausibly solvable by the LLM. And honestly, that is the trillion-dollar question that companies today are facing. And that is why most companies are failing at artificial intelligence, deploying it at the medium level in the lower ranks. It's the lack of context for the day-to-day basis. So we all know the 4 eras, how incredible the last 4 years have been from the launch of ChatGPT 3.5 till today with OpenClaw, Opus 4.6. We started with these silly like poems asking ChatGPT to create like a pirate song and something silly. And then that kind of transformed into a more conversational tone where you could actually extract information from it. And with 2024, early 2025, with the release of the Model Context Protocol and Google ADK and all these different frameworks, we really started to dip our toes into the true abilities of artificial intelligence. And now, where you can give entire corporate context and you can engineer it in a way, you can do something beautiful with AI. So what I have done is created a second brain, my way of organizing all the documents, all the decisions, all the spec sheets, the customer interviews, the deep research reports, the foundational information, the thesis that I run my business on. I've organized it in a way that is highly traversable for an LLM to gather context really, really quickly. And this that you're seeing is called Obsidian. It takes markdown format documents and turns it into something very easy for AI to use, or AI loves markdown format documents. And I've created a tree dividing my business into specific areas of engineering, of product development, of user experience and UI design, to customer interviews, to legal documents. And this is a really, really intuitive way for me to give context and engineer a way for me to use AI very, very efficiently. And I've done this through creating an orchestration layer with 6 or 7 fundamental files that you need to absolutely have in every deployment of artificial intelligence. If you want to use it for your business, you need to have this, where you have the different short, concise documents that is always loaded into your AI's brain, essentially, at the start of every conversation. And this kind of is the starting point to load all the other context. And I run through a daily loop. This is how I work every single day. And I'm engineering a enterprise grade platform that needs SOC 2 compliance, and it needs to be extremely scalable with a tremendous amount, or it needs to have great uptime for an enterprise client, and there needs to be customization into the ATS. There's so many different things, but how I've managed to distill everything is through these daily loops that I've created. So every morning I run a morning essentially guide of like, what are we setting out to accomplish today? And from there, every conversation that I have at the end of each session, I do a log. So a long conversation, I essentially take the summation and all the critical decisions that we've made in that conversation, all the lessons and all the bugs that we've solved, and I put that aside. And at the end of the day, through 40 different conversations, I run an end of day, which consolidates and prunes all this information, because AI loves to output a tremendous amount of stuff. And a lot of it is deferring and a lot of it contradicts. So this is a way to aggregate everything and keep your documents fresh. And another unique thing that I've started to do is have these different skills. Specifically, one is debate. So I don't have a PhD in industrial organization psychology, but I have created a way to set up personas that can debate as if they are my customers or industrial psychologists or devil's advocates. And this debate allows me to iterate and find and stress test my ideas really, really well. And one thing that I've noticed, and one thing that we are struggling with as a society, is where do we draw the line between AI usage and human usage? Because if you defer your critical thinking, it can deteriorate your cognition. And I have seen that as I use AI more and more, something like my writing skills, they kind of deteriorate. So you need to draw a hard line between where you use AI and where you need organic and critical thought. And for example, for my projects, industrial psychology, customer research, sales, all of that needs to come from within. And I can use AI to enable me to accomplish those tasks. For example, executing code, developing features, or aggregating all of the data and all of the open source knowledge that we've gathered and turning it into a product. So the major takeaways: if you build one thing, it's these orchestration files, so like a status.md, where you can constantly track what is going on at that moment in time. And your system is only good as the context through which you built. I have managed to write 600,000 lines of code with a 99% uptime, which is incredible, using a system like this. And that right there is a QR code. If you would like to demo our product, would love to invite you to our open beta, which we are running right now. But thank you so much for your time. If you guys have any questions, I'd love to answer them.
Tristin, thank you so much. I don't see any questions teed up yet, but I have a couple.
Sure.
Just to get the conversation started. We have time for a few questions. So what are you finding in your development? Which tools are you using most in development versus some of the other business aspects? Given you're a founder, you're probably doing sales and marketing and business development. Yeah. And so what tools are you finding that you're using most?
By far, it's Claude. By far. I've run different benchmarks and have found that Claude is the most reliable and on the quality of answer that it gives, and it pushes back on reality. Something that I really appreciate is not going into AI psychosis or getting gaslit, essentially, where some models like ChatGPT and OpenAI, and especially Gemini, they have something called creative compliance, where you can ask a question very directly and it gives you an answer that you want to hear, rather than an answer that is objective with some sort of grounding. And I use Claude. I prefer Claude as my primary LLM, but I use other tools that I've built myself, like different MCP servers, model context protocol servers, that kind of tap into my second brain. But Claude Code, Claude desktop app, Obsidian, which was that UI that you guys saw, and a few other really technical tools that I could answer if you guys would like.
So is most of your code being written with Claude Code, or are you designing your architecture with a more traditional approach?
So I am designing the architecture, the big swaths of essentially this is the direction that we are going to go. These are the tools that I want to integrate. These are the APIs. This is where the code will live and how it's deployed and how it will talk to another microservice. Claude's job is to go and execute that code and to make sure that my standards are being met. I can share the barcode again, and the QR code. But this comes down to, where do you draw the line between delegating to AI, or where does the human step in? And human in the loop is absolutely critical. If I ask Claude to just go and build a company, it would get lost down a rabbit hole. So it is a constant back and forth. I treat these AI tools as a kind of partner to bounce ideas off of, while going and doing my own research and validating that the direction or the suggestion that, like the critical suggestions that AI is producing, are actually true. For example, I was evaluating different deployment methods. So either Docker or hosting it through different, running it on like a metal machine. And one thing that AI really loves to do is to just make it as complicated as possible. So I've had to really force the Yagni principle, which is you ain't never gonna use it principle, where it needs to be just as pragmatic and as objective as possible. Because AI it's designed to output stuff that we think is good. So sometimes with some developers or some companies, they measure a individual's quality based on the amount of code that they write. And this can translate over to using AI. It's like, okay, the fact that we're writing so much code is good. That's a good sign. But in fact, the simpler, the better. And it took 4 months for us to write those 600,000 lines, but we've stress tested, and it's been battle tested, and it's currently being used by enterprise clients. So far, so good.
That's exciting. Congratulations.
Thank you.
The enterprise clients are tough ones to close.
Very hard.
Yeah, they are. But then they can help sometimes in terms of developing your product, giving you feedback, and getting you to the next level, and understanding where you are as a smaller company getting started.
Absolutely.
What do you think? How much of a role is AI going to play in the next 12 months of your product development specifically?
Without AI, we couldn't be here. I want to be quite honest. My previous company, Uniwise, was a medtech artificial intelligence company. We built software to optimize and to make efficient organ donation in the United States. The hardest market, which is medical, with the most regulation, with the most bleeding edge technology, which is a black box. So there's a reason why I've pivoted and transitioned to a new role. 15 developers who were UCSD graduates. We had 2 PhD students. I had a brilliant CTO, and we were unable to make a product that was decisive enough to sustain a contract with the company. And I am now using AI by myself with the limited amount of knowledge I have in coding. Like, I'm self-taught. I didn't, get a master's degree in computer science. And I'm able to build a platform of this size with I would say it's objectively more functional than the platform we built previously. So it's fundamental in our
Good.
company's survival.
Excellent. Okay. Well, very good. We have one more question here. We have
Sure.
time for that. What kind of rails are implemented around the use of these agents for development purposes? With access to all tooling, even a minor error could lead to disastrous outcomes, especially when there's no human in the loop, which you referred to. Curious to know how you and the team are working around this.
Absolutely. So I am the team. Again, I'm the only engineer building this. And AI does not operate without human in the loop. Every single decision, every single commit, every single line of code is reviewed by me through the terminal. So I use VS Code, Visual Studio, with the Claude Code plugin. And I go through these daily loops with these context maps, and I guide it to a destination, fact checking, pushing back at every single stage, and bringing in other models as well to run these debates and to go through loops to improve or to simplify. I also run everything in a sandbox. I do not let AI do not let Claude Code push to production. Just recently, I actually wrote a LinkedIn article about this last week. I was messing around with a new tool called Forge Code. It's a Claude Code competitor, and it scored very high on a benchmark on, I think, humans last exam. Maybe not humans last exam, but there was a major benchmark that it scored well on. And I set it up with Gemini, and within 15 minutes of having a conversation about architecture, it tried to delete our production database. And without guardrails, without running in a sandbox, it would have done that. And I got so angry that I uninstalled it, and I made a post on LinkedIn, and the founder of that company messaged me and told me that he wants to give me a 30-minute discussion about using this again. And it's hilarious, and it's on my LinkedIn.
That's a hair-raising moment for sure.
Yeah, so absolutely human in the loop with restrictions on what these agents can touch.
And
you
the
cannot let them unsupervised.
Absolutely in a sandbox.
We are not at that stage yet.
Wonderful. Thank you so much, Tristin. You're doing amazing work with amazing tools, and it's a fantastic example, exactly the kind of stuff we were hoping to have in the student spotlights. And with that, I'm going to share my screen and introduce our next student. Next, we have Brian Helewa, who is a bioengineering major, and he's applying AI to one of the more complex and often overlooked and under-optimized areas of healthcare, which is chronic wound care. So Brian has founded Innovacity. It's an AI-powered wound care assistant that uses imaging, AI, and computer vision to help clinicians assess wounds more quickly and accurately. This is a space where misdiagnosis and variability can have serious consequences, not just in outcomes, but also in time, cost, and patient experience. By bringing consistency and speed to wound assessment, this kind of solution has the potential to meaningfully improve care delivery at scale. Brian will share how their system works and where they see the biggest opportunities for impact. So Brian, welcome. Looking forward to your presentation, and I'll turn it over to you.
All right, thank you so much. I'll share my screen right now. Hi, everyone. I'm Brian. I'm the founder of Innovacity, and I'll present our product, Medimorph AI, which uses AI and 3D reconstruction to turn smartphone wound photos into objective clinical assessments. This is a quote from a CVICU nurse that I interviewed. They worked in a community with 0 wound care specialists, and they told me that Morph AI feels like a bridge between the future of medicine and where we are right now. And here's what we do in a simple snapshot. You snap a photo with any smartphone, and under 2 minutes, you get back a 3D wound model, objective measurements like area and depth, tissue classification, and then a drafted clinical note that the clinicians can then use for diagnosing. No special hardware, no training, just a phone. The real problem right now, though, is that there are 1.6 million new diabetic foot ulcers every year in the US alone. And Medicare spends about $9 to $13 billion annually on wound care. And 34% of those diabetic foot ulcer patients end up readmitted. And this is what hit me the most, was this silent epidemic, the misdiagnosis. There's 41% error rate with manual wound measurements, and that's mainly due to no standard care methods. A nurse holds a ruler or a hand measures the wound, and that causes a lot of human error. And these nurses, they're not even trained for wound care. There's no specialized wound care training in their education system. So about 10,000 wound care specialists are present. There's 4 million patients that have these wounds. So there's not enough wound care specialists to deal with them. So this isn't even a technology gap anymore. It's an access gap. And every time a wound gets misstaged, it costs the system around $20,000 per readmission. So our solution, which can be broken down into 3 steps, as mentioned, is you take the photo with utilizing the LiDAR on your phone. So any phone can be used. Our AI pipeline segments the wound boundaries, estimates 3D depth from the image, classifies the tissues. Then you get a clinical report with the exportable metrics and draft SOAP notes. So there's no rulers, no guesswork, no human errors in those measurements, and there's no special equipment necessary. And our MVP is live and working today. So this is the main portion of what we have built with our MVP. There's mainly 4 things. First, which is the 3D reconstruction. We're using a vision transformer model called VGGT. This takes regular smartphone photos and produces a precise 3D mesh. Second is an automated metrics engine. That's for the surface area, volume, depth, perimeter, all these necessary metrics for wound assessment. And they're directly from the 3D geometry of the wound, which is more realistic than a 2D image of a wound, which you'll see in that a lot of like technologies now for wound diagnosing is just 2D image. Third would be just the tissue classification. Our system identifies granulation, slough, eschar, these red colors, pink colors. There's no specific way to tell unless you're able to classify the tissue areas. And that is a very useful information for these nurses and specialists to know in order to make their full diagnosis. And then the last part is just the clinical overview of the report, which this nurse in the loop of this AI system can then send to the wound care specialist to know what the further treatment is. As mentioned with all this technology, there were 3 hard problems and 3 engineering choices made throughout all this. First would be the point clouds from consumer phones, the photos. They're very noisy and full of holes. So we use our system, the VGGT, a vision transformer out of Meta that does dense stereo matching, and we follow it with a mesh cleanup pipeline to get a realistic 3D wound. And this whole thing will run under 2 to 3 minutes on a consumer GPU. And then second is wound boundaries are generally hard to detect, even for nurses like measuring them by hand, and especially across different skin tones. So we're using an SAM-based segmentation with wound-specific fine-tuning, and it works across the full Fitzpatrick scale, like I through 4. It's more of just trying to create this kind of heat map of the different types of wounds you would typically see, because there's not one wound you could base off of, especially with how many different skin types and different types of precisions on the wound. And then third is clinicians don't want a point cloud view. They want like a realistic 3D view. They want something that you can actually chart with these metrics. So we extract these metrics to a standard JSON format, and we use an API to draft the SOAP notes into a language they already use. And then this viewer can just be loaded and uploaded to their wound care specialist later on in the system. So We've done over 25 interviews with nurses, doctors, wound specialists, and EMTs. And the headline finding is that this product has a clear, immediate view in both hospital and at-home settings. Some of what we heard was that 1 in 4 wounds get misstaged because there's no standard way of measuring them. Faster wound triage came up as the #1 priority for improving ER flow, and cutting length of stay by even a single day saves $25,000. And 70% of nurses told us that wound care was barely covered in their training. So even our primary persona, the CVICU nurse that we interviewed, you can see the summary at the bottom. They receive about 8 to 12 patients per shift and 3 to 5 wound assessments a day, and there's 0 wound specialists available in her region. So that just leaves them with no specialized training to give a correct treatment. So it's left to more time loss and more problems for the patient and the hospital. Our total addressable market is 21 billion. That's 260 million wound care visits a year, all wound types and all care settings. But then we're focusing more on the diabetic foot ulcers, which is a market that is 1.8 billion. And there are about 22 million diabetic foot ulcer visits per year. And then our serviceable market would just be the 175 million of wound care clinics, VA hospitals, and health systems, when we start landing our pilot. In the competitive landscape, there are a handful of players here. Moleculite does bacterial detection with a dedicated handheld device, and then Spectral MD does a perfusion imaging, but you need more technology and like a cart for that to be used. Swift Medical is a phone-based one, but it only does the 2D image, not the 3D. What makes us stand out the most is that we're combining a 3D measurement, something new to wound care, with that tissue classification and that auto-generated clinical notes into a single smartphone app. And this can just be worked and easily accessible by anyone as a nurse and even potentially home care as well. So right now it's me as the founder and the one working on all of this, but currently we have hired some engineers to help us with the back end and developing this viewer for clinicians to use. And I'm the one that was running all these interviews and constructed the architecture for all of this. But luckily, because of these new recruits that I'm getting recently, we're going to be probably having a faster pace on our progress. And here's our roadmap. We are really early staged. We've just developed our MVP, and now we're trying to get the clinical validation just to go into having it accessed by the public. So we want to partner with UCSD Health and getting an IRB approved for this, so then we can start testing more and getting more of that validation. And then long-term goal is that FDA 510K clearance. And that's the one thing that has made, I think, anyone running a startup, the hardest part is trying to get that clearance through the FDA. Thank you so much.
Excellent. Thank you, Brian, so much. I admire what you're working on. And it's good to see an application that has such broad use. We do have one question. You had mentioned earlier in the beginning of your presentation that you take the picture with your phone, but then you mentioned LiDAR. Would LiDAR be more in the professional setting, like the clinician, and then phone would be the consumer?
Yeah, so LiDAR is actually utilized in our current phones right now. Your Apple phone has LiDAR on the camera. So we utilize that LiDAR detection for this 3D construction. So anyone basically with a phone can use it.
Okay, thank you for that clarification. I used to be in the phone business, and at Apple, I didn't know that. I have one more question. I was curious, you're using visual computing, and I also used to be with NVIDIA, so I have a keen interest in visual computing. Did you work with someone to develop a new kind of not language model, but large visual model? Or is there one out there that you're tapping and accessing on wounds? Or how do you access and match that data from the visual computing standpoint, from the image you get to something that does the inference to make recommendations?
Yeah, right when I first started it, I was using the VGGT, which is something from Meta. And I was playing along with it. I wasn't using anything like for testing at that point. I was just trying to understand how to work with that. And then I spoke with a researcher here at UCSD that was also trying to do something similar to what we're doing, of trying to capture a wound and reconstruct it. And then I don't know if you guys know about Maverick Studio, but they're working with like virtual reality. And I was speaking to one of their mentors, and she brought along this method of using a Z map of structure. It was like a different testings with different types of resources. And I think I generated this kind of pipeline myself on this. So I haven't, and there's not really much research being done with the 3D reconstruction of wounds. So it's really hard to navigate through this, but I think I'm going in a direction that's very new.
I love it. Greenfield for you. Excellent. Well, like seeing what you're doing. And thank you, Brian, in the middle of finals, making this effort and time. Really appreciate it. We have one more student today, a student team. So finally, we have Yashraj Gavhane, who is working at the intersection of AI, healthcare accessibility, and hardware innovation, notoriously challenging. Yashraj is completing his Master of Science in Computer Science at UC San Diego now. I think he's finishing, is it this month? And he's part of the team behind Peekaboo, which addresses a critical gap in early detection of retinal diseases like diabetic retinopathy and glaucoma. And these are conditions where early diagnosis can be all the difference between preservation and loss of vision. So their approach has an elegant and impactful kind of balance to it. It's a low-cost retinal imaging device that attaches to a smartphone paired with AI models that can analyze image and flag early signs of disease. So this has enormous implications, especially in primary care and low resource settings where access to specialized equipment is pretty limited. So Yashraj will walk us through how the system works and how it could expand access to preventive care. And I believe, Yashraj, you brought a team member with you joining. So I'll let you
Yes.
introduce your colleague. Great to have you both. So over to you.
Yep. Hello, everyone. We have Sneha with us, who's my co-founder, and we are working together on this. So let me just share my deck. So we are working on something that we call Peekaboo. It's supposed to be an AI-powered retinal screening device. Just to give you a background idea of why we started trying to solve this problem. Late diagnosis is a big problem. Over 1 billion people suffer from preventable vision impairment globally, and there is a critical lack of eye specialists, especially in underserved areas, rural areas, where there are a lot of people, a lot of patients, but the amount of doctors is just way too less. And there are equipment barriers, like the current equipment for, especially for ophthalmologic needs, is really expensive and really bulky. So it requires patients to visit clinics, visit hospitals, which may not always be possible based on the distance they live from the hospital, or maybe just the lack of awareness that some diseases can, if detected early on, can prevent like getting worse down the line. So that's why we thought that this is a really important problem that needs solving, and this is something that would benefit a lot of people. The main point here being early intervention is the key. Early stage retinal diseases often show no noticeable symptoms, making self-diagnosis impossible. So usually we don't even realize that we might have something, just because eye checkups are not something that are done often, especially if you don't have any corrective lenses or corrective glasses. Anyone won't go to an ophthalmologist, just for annual checkup. That's pretty rare. So the diagnosis doesn't happen early on. It happens only when the patient starts seeing symptoms, and by then the disease has already progressed to a severe form. And the whole idea is to see if we can diagnose the disease early on and help them get better before the condition worsens. So Peekaboo, it's a portable AI-driven solution. So the idea is to have a device. It is just a lens which fits on top of a smartphone, and having the application in your smartphone which would help you capture. And so the idea is to help doctors. It may not necessarily be doctors, but can be healthcare professionals or nurses who can go out in the field, reach out to people, and do the screening there itself at the side of the patient. So basically, they would be using a scanner to get a fundus image of the patient, and the on-device ML models would then analyze that image and provide an instant analysis. Like we won't be doing any final recommendations. The only thing that we want to do is if a patient needs help, that is, if we detect a disease presence in the patient, we want to refer them to a doctor, because at the end of the day, we believe a human doctor should be making the final decisions and taking the final call. So this is meant to just augment that and not replace doctors. So the process is pretty straightforward. So we capture an image, the AI on-device AI analyzes it, it detects the kind of disease the patient might have, and then it recommends the patient to a doctor for further clinical investigation and help. I think Sneha can take over from here.
Yeah. So let's talk about the intelligence behind Peekaboo. So at the core, we use modern CNNs to extract meaningful features from the retinal fundus images, which is basically a picture of your eye. And and it identifies the patterns which are associated with the specific disease. So we've designed the system as a multi-label model, which means that it can detect multiple conditions at once. And this is important because in real clinical settings, patients often present with more than one issue simultaneously. Another key focus for us is deploying the model. We're actively optimizing these models to run efficiently on mobile devices so that the screening can happen directly on a smartphone without relying heavily on cloud infrastructure. So the goal is not just to build an accurate model, but building something that is practical and usable in a real world environment. Moving on to the next slide. So building the model is just a part of the bigger problem. The bigger challenge is making it work reliably in the real world settings, as I mentioned. So retinal images can vary a lot depending on the lighting that is there while clicking the image, device quality, and how the image is captured. So we've designed a pipeline to handle that variability. So we first apply basic image pre-processing steps like improving the contrast, reducing noise, to make the images more consistent and clinically useful at the end of the day. So during training, we also incorporate data augmentation so the model learns changes in brightness or orientation. And overall, the pipeline is designed to be efficient and low latency so that it can support real-time screening workflows. So the goal at the end of the day was to ensure that Peekaboo performs consistently in outside controlled clinical environments as well. So moving on to the next slide. What makes Peekaboo powerful is not just the technology, but the scale of impact that it'll enable. First, we designed it for low resource settings. This means rural clinic, mobile health camps, and communities where traditional retinal screening equipment is simply not available. Second, it improves the specialist efficiency. Instead of doctors screening every patient manually, Peekaboo can act as a first pass triage system, helping prioritize high risk cases. And third, we enable early intervention. By identifying potential issues early on, we can significantly reduce the risk of irreversible vision loss. And finally, the solution is inherently scalable because it builds on widely available devices like smartphones. And it can be deployed across diverse healthcare settings without the heavy infrastructure. So at a high level, it'll help us shift eye care from reactive treatment to a more proactive screening situation. So moving on to the next slide. Looking ahead, we're focused on three key areas. First is improving the deployment. We're working towards making the system more efficient and accessible in low resource setting areas with the long-term goal of enabling seamless offline use. Second is clinical validation. We want to expand to real-world testing and conduct broader studies to ensure the system is reliable and ready for clinical use per se. And third is building the right partnership. Scaling this kind of solution requires working closely with healthcare providers, organizations, global health initiatives. So our long-term vision is simple, just to turn any smartphone into a vision screening tool. and ultimately to make early eye care accessible to anyone, anywhere.
Thank you. This is a fantastic application for people who are experiencing early signs of vision loss. By the time we recognize it, you can't get it back. So early detection is so critical. This is an innovative application with a very good market. I don't see any questions, but I have a question. When you talk about on-device optimization, I know that phones today have so much processing power, it's pretty incredible. But when you're talking about imagery, it still seems like that's a lot. So my question is, how are you balancing between the back end where there's a visual library, if you will, of comparison, and some of that processing is being done on the phone, but then some of it's sent over and being done on your platform? How does that work, balancing that workhorse aspect between the phone and your platform?
Yep. So that's a really good question. So we are not using any of the large language models, neither the vision language models. We are relying on the traditional imaging models, like image classification models. So we are trying to use transfer learning and train models like ResNet and VGC so that they are relatively way lighter compared to language models, and they can be easily run on mobile devices given the performance that we have in devices nowadays. So basically, it would be like the model, once it is trained, it would be saved on the device. And once then you don't need access to internet or anything, it just uses its saved weights to analyze any new image that it gets.
Any other questions? Let's see if I'm missing anything. Okay, thank you so much. Again, in the middle of finals week, next quarter, the students will not be subject to this cruel and unusual punishment, but really appreciate the efforts. In the meantime, I'm going to just quickly go through what's coming up the rest of this month and then April. We have one more webinar. This is the foundational series. We also have AI perspectives. And March 24th, we have Winning the Hearts and Minds of Customers, Regulators, and the Public. So if anybody's interested in that, we will be sending out the links to register for these webinars, or you can scan the QR code. And then in April, we have, of course, our foundational series, AI Meets Life. That's April 15th. You can go in and sign up for all of April, May, June webinars all at the same time. It's really easy. And that way you can pick and choose or always get the recordings. And then AI Perspectives. On April 21st, we have AI and legal and ethical challenges associated with developing and deploying AI. That should be a very juicy topic. So I'm really excited about that one as well. Of course, Triton Giving Day, April 29th. You'll be getting emails if you haven't already. We love the participation. And then we'll have a workshop on AI optimized career strategies. We don't have the date for that yet, but if you join the LinkedIn group, you'll get all this information updated. And thank you so much. Really appreciate all of our student teams today and your attention, and have a great rest of your day.